Hello, everybody, and welcome to The Advisor with Stacey Chillemi. And today I'm very excited because we have a very special guest on this show today. We have Dr. Demian, and he is a pain management specialist. He works with into surgery, and he has so many things he's going to talk about today that's so interesting. And today, so many people suffer from pain. Chronic pain is something that we all endure, at some points in our lives. And some people struggle with it on a day-to-day basis. And it's very hard to deal with life when you are in pain. And today he's going to talk about how he got started in it and some of the great things right now that are going on and the advancements that play a role in our today and in our future. So, Dr. Damian, it's a pleasure to have you on the show. I'm so glad you came on the show. And, there is so much going on in today's medical field when it comes to pain management and pain management surgery and the different techniques and the different things that they're doing now to help people. Now, for you, can you tell everybody a little about yourself and what you do before we begin?
Thanks for having me, Stacey. Absolutely. My name is Hany Demian. I'm from Egypt. I born, raised, did my undergrad in Egypt and moved to the US, did a fellowship. I was hoping to get a job. It didn't materialize, so I moved to Canada, where I started my career there into emergency medicine, then switched to chronic pain. I've been doing chronic pain management for 20 years and helping patients day in and day out. I needed to give them more. This is when we decided to look somewhere else other than Canada to help our patients. So we looked for the best platform in spine surgery, and we found it here in Florida, Biospine Institute, where we acquired last year. They've been doing minimally invasive and great results for 20 years. And now we're pushing the boundaries even further, doing microinvasive regenerative medicine and anti-aging, as well as chronic pain management as well.
That's amazing. So many people are, suffer from pain and they don't realize that you don't have to pop a pill. They don't have to go to the doctor and take, pain medication. A lot of these pain medications aren't good for you to begin with. There are so many ways out there, to help a patient, overcome their chronic pain. Can you maybe, we were talking previously about PRP and some of the other techniques they have right now that they offer to help people heal themselves naturally. Can you talk about some of those things that they have right now in the medical field, in the industry?
Chronic pain management is, I think, it's the youngest specialty in medicine. It's been there only for almost 2 decades. There is a lot of catch up, but it's growing so fast, like you said. And traditional pain management was a pill, like you said, which we don't use anymore, which is opioid or narcotics. And we know what happened was that and the opioid crisis or a cortisone shot,
Yeah.
which causes degradation in bones, ligaments, and cartilage, or end up with surgery. So there
Mhm.
was a gap. Right now, we fill this gap with regenerative medicine. We can use the body powers to regenerate, grow, and heal itself. We use the peptides, exosomes, or the platelets to actually activate the growth factors to heal the ligament tissues and cartilage. And we've been getting great results with ligaments, and we're adding more usage for this all the time. We've had great success with shoulders, knees, hips. Not only this, with spine as well. We were able actually to recreate the discs in the back through stem cells and PRP and give the patient the relief without surgery. Just an injection, it's done 10 minutes after harvesting the stem cells. So we're quite optimistic about this. We really hope that that will be the future of chronic pain. And a lot of patients can benefit from this before actually going towards surgery. Because we all know from experience that surgery is great and it could be one of the good options, but could not fit in the lifestyle of the patient.
Right,
Surgery for a 20 years old is different than surgery for somebody at 60 years old, right?
right.
And going back to your activities, you'll be stuck at home for 3 to 4 months to recover after surgery, which is not optimal. So
Yes.
I would hope that the patient will exhaust all their options before actually thinking about surgery.
Yes, I agree 100% with you. And a lot of times when I have spoken with doctors and they work with PRP, they say it's very sad, but they'll have people come into their office and they're bone on bone in their knees and they could barely walk through the door. And they have an option to do PRP, and it will actually rejuvenate the tissue in their knees and help them to overcome the bone on bone in their knees that are causing them to barely be able to walk. And a lot of times, some patients will go with the surgery because it's covered by insurance. But can
Yeah.
you explain like the pros and cons of, why PRP is such a better option than surgery if they have the opportunity to do it naturally?
PRP is like you said, it's natural, very minimal side effects. It's your own tissues, its own cells, and it actually not only regenerate the tissues, but the new technology like peptides and exosomes mixed with PRP will actually fix the DNA, which means that it can build the cartilage back. Some of those cells are um, can convert to building new cartilage, new ligaments, and actually some will convert to building new bones, right? If you leave the knee all the way to bone and bone, like you said, of course, was this kind of advanced state, you will need surgery. But surgery means that we're going to go in, we're going to cut muscles and carve bones,
Mhm.
sew it down, and put an artificial knee in there. How long is the recovery? We're talking about 6 months with the best surgeon. And it's quite surgeon dependent. So if you fall under a bad surgeon, right, things could really go bad or could go sideways. I've had patients with one limb's longer than the other after the knee
Oh,
surgery. Yeah, yeah, I had patient with inches difference, and they had to,
wow.
to wear shoes just to compensate for that, which unfortunately will put back pressure on their back and
Yes.
will have disc bulging and herniated disc. So why can we exhaust all the options? We can do stem cells now, and there are new advancements that we're looking at, like umbilical cord blood cells that has billion cells and can build the cartilage back, depending on the stage, of course, the knee is at. But there is hope that you wouldn't need the surgery, right?
Right.
Plus, those prostheses, which is the knee replacement, only lasts for 20 years, right?
Right.
So after 20 years, you're gonna have to do it again,
Yeah.
right? And what kind of sports, if you are into sports, that you will be able to do or practice with an artificial knee. So I will advise patient to please exhaust everything possible before thinking about surgery. We do have surgical centers and we do surgery, right?
Mhm.
But I personally still practice and I tell my patients avoid surgery at all costs. Let's try as much as we can to do something before going to that option.
Now, I know you're so passionate about this. How did you start with all this? Like, where did it begin where you started to have such a passion for helping others and healing and really focusing on not the surgical part first, but trying to get them to heal their bodies naturally before resorting to surgical procedures. And because you have such a passion for doing this and you've been doing it for such a long time. Can you give us a little history on how it all began and what made you go in this direction?
I would like to go back to how did I start at the medical school. It's actually a weird story, Stacey. I didn't want to go to medical school.
Oh,
My father is
really?
a doctor, my uncle is a doctor, and I didn't want to go to medical school. I wanted to do something different. I wanted to go to business. So I got my application after high school and I was going to the American University in Cairo, AUC, and that day, unfortunately, there was a terrorist attack. A lot of
Oh,
bombing.
wow.
Yeah, was bombing and a lot of people died and body parts and whatever. And I
Wow.
stayed all day helping people. I
Wow.
didn't see this side in myself before, but I went there and I ripped my application apart. I said, "Yeah, I want to go to medical school. It feels so fulfilling
Yeah.
helping people in need and vulnerable people that day." And I never looked back. Went to medical school and I decided, okay, let me help people more. I decided that by going to general surgery and breast cancer, breast reconstruction, because my mom had breast cancer,
Hmm.
right? And then I decided, okay, let's find a treatment for cancer, which didn't work well for me.
Yeah.
So anyway, and then did emergency medicine, loved it for a while, and then I started having back pain myself, right? I got married. My wife said, let's have some life changing, have 9 to 5 job, which I said, okay, let me look into something. And I found chronic pain because I did have, I worked a lot of sports. I got into a lot of car accidents. I used to box as well. So I got neck pain and low back pain. And I said, that will really be very helpful for myself, and I will connect more with my patients because
Right.
I feel their pain literally,
Yeah.
right? So I start my journey there, and I didn't want to have surgery. I was offered surgery. I have torn muscles in my shoulders that I've been treating with PRP for years.
Hmm.
I ripped the muscles in my abdominal muscles at the gym, and I couldn't get out of bed the next day. I had to
Yeah.
roll out of bed. I couldn't believe how much pain and how much abdominal muscles are valuable.
Yeah.
So my partner at the time said, "Let's use PRP." I said, I don't know. I think I'm gonna have to go see a surgeon and let's stitch it up, right?
Mm.
As a surgeon, that's what we do. You cut open and you look around and fix what you can,
Yeah.
right? And he
Hmm.
said, let me try before you go do that. 6 weeks later, I was doing abs again.
Wow.
Yeah. And they said, okay, we're really up to something other than a pill, a cortisone injection, or going for surgery. There is something in the middle here. And if we can expand the use of this, it will be amazing for myself and for my patient. And this is really what hit the nail on the head. I said, okay, I'm gonna do more research on that. And we've been adding a lot of uses for PRP. We use it now for not only for this, for carpal tunnel. We can fix patients with carpal tunnel without going for surgery. Neck pain, we can fill the discs, like I said, in the vertebrae with stem cells. We use it even if the patient go for surgery, like shoulder surgery. We do 2 sessions of PRP to accelerate the healing and the
Hmm.
recovery. Knee surgery, we do it as well after. As I said, we had one of our patient that he came right after injuring his ACL, anterior cruciate ligament, and after 3 sessions, we had an MRI, and it's completely healed, Stacy.
Wow.
Yeah, we all know that a surgery for anterior cruciate ligament might leave you stuck for almost 6 months,
Wow.
right? So can you imagine healing this? So that really give us the idea to really expand on that, and with our trials on peptides and exosomes that enhance what we're doing. And this is what we've been doing now for a few years, plus the traditional pain management and spine surgery, and we're getting great results. Our hope is just to help as many patients as we can, um, without side effects, without going under the knife.
Yeah, I love the idea of using PRP. I've used it and it's helped me. And I even had a friend, he was in the gym and he tore his rotator cuff from weightlifting and he went for PRP. And after a couple applications, he was back and he was doing fine. He didn't even feel the pain anymore. It had went
Yeah,
away. And he was ready to go back to the gym. I was like, whoa, can you relax a little before.
I love those stories. It just it just really resonate with me that I think this is the future for chronic pain management.
Yeah, I think there's so many advancements now going on in our medical field. I think there's so many things, I know that that there's, in the future there's a lot going on right now and they're doing a lot of research and they find that PRP could be used for many things. We were talking right before the show, we were talking about how it all started, it started with athletes, they were doing it on the athletes and they realize, hey, if it can work on the athletes, in their knees, and so it could probably, we could probably do a lot more with it. And it all began, what do you see in the future and what do you see now, like all the different advancements that are coming out, how we could heal the body naturally so people realize, you don't have to go for that pain medication. You don't have to run and get surgery done. That's because a doctor says, I think you need surgery. There are other options, get a second opinion, go to someone who deals with PRP. And I think a lot of people get scared because they don't know a lot about PRP and they don't really understand, how powerful it is and how well it works. They're worried more, well, if I try it and if it doesn't work, they're worried about the investment. And, but do you want to feel this way the rest of your life? When you want to take care of your grandchildren, do you want to be able to, run after them, or do you want to be able to, not hold them in your arms because your arms are in so much pain?
Um, PRP has been used for many years, and the initial PRP ideas, believe it, Stacy, is coming from the ancient Egyptians. when they go
Hmm.
for war and they have cuts or injuries or whatever, they used to do something called blood patch. So they get blood, they patch it with leaves,
Oh yeah.
and they band-aid their uh, cuts and injuries and whatever they have. Broken bones, they used to do the blood patch. So it's been used for body to heal itself for quite some time.
Wow.
And they didn't know why. Now we know, and now we can activate the platelets that will be able to heal the tissues that we wanted to heal. So we inject, it's pretty simple. We take the blood, we spin it, we get rid of the stuff that we don't need, which is red blood cells, and we
Yes.
keep only the platelets and the plasma, which carry the growth factors. They have inflammatory factors, so they go in the area that we needed to heal,
Right.
and they will call on all the other healing factors from your body. They will
Right.
call on all the cytokines, they will call on the growth factors, and we say, come on here, let's heal this part.
Hmm.
And they aggregate and they eat up the bad tissues, whether it's infected or older tissues or whatnot, and they start forming new clean tissues, whether it's collagen, fibrin, or whatnot. So it's your body just doing the job that it should be done. It just, unfortunately, when we age, the body doesn't have the tools to do this. So you're giving the body the tools to actually heal itself. There is nothing better than this, right? We've all tried regular food and organic food, and we know that the organic food is better, right?
Right.
So why don't you let your body heal organically,
Right.
right? And it could be, it's not like I said, patient selection is the best. You need to know your patient, you need to know what will fit them and what not. As we were talking before, the most challenging patient for me are the younger
Hmm.
patients. They're very challenging because they're really smart.
Yeah.
They know, and they're very knowledgeable before they come for a consult. They know what they want,
Right.
right? They Googled it, they researched by name, they've done their homework, right?
Right.
And they will challenge you. And after a while from dealing with younger generation, I loved it. It was challenging initially, and I loved it because
Yeah.
a 20 years old coming for a referral, I can't tell her, him or her, take this pill for the rest of your life.
Right.
You're 20 years old, you're gonna take this pill for the rest of your life. They're gonna look at me like I'm crazy. Or
Hmm.
come over, I'll do a cortisone shot every 3 months for the rest of your life.
Yeah.
Right? And I can't tell 20 years old, okay, I'm booking you for surgery right away. It just doesn't resonate, doesn't connect with them. They need a quick fix. They need as less pain as possible, and they're not very patient,
Yes. Hmm.
right? Which is good quality. So that brought us to what we are having today, the advancement. We had to push to fulfill the need of those younger generation, right?
Yeah.
Which is regenerative medicine, peptides, anti-aging will be able to fix the need that they have, right? Will fill this need by having something fast, healing, and very minimally invasive, and will not end up with surgery and you're stuck at home for whatever reason for many months with rehab and the bills from rehab and whatnot. So it's actually fascinating that the younger population are pushing for that while we're trying to convince um, other generations this is the best use for them.
Yeah.
Right?
I think a lot of times when the older generation is just not well, the knowledge about it is limited. So when they hear about it, they don't really understand the full potential and how powerful it is. My dad's had bad knees for the longest time, and I've been trying to get him to do PRP, and I can't get him to budge. He's just stubborn in his old ways, but if he realized, I try to explain to him, I went through the whole procedure, how the blood separates from the plasma and how you take the plasma and you re-inject it into the body and then into the area that's affected. And then it starts to rejuvenate the cells and, now new growth tissue and the healing process begins. And, sometimes I think it's the old school that the lack of knowledge, if we can get more knowledge out there and we can explain to people and somehow, they understand understand it before they come, they'll have a better understanding of why it's so important to go the natural route. And I think nowadays that even with they're seeing how these medications, it's more publicized of how much damage it's doing to people and how people are getting addicted to some of these medications and, and how it's affecting their long-term health. People are now looking for that. Definitely see me. People are trying to look for more healthier, natural ways to heal their body.
It's quite amazing for me, especially with the pills and opioids, because opioids or medication generally have side effects. Anything that we take in a medical form, it will cause a problem. So I give the patient, I used to prescribe a lot as well, because that's the only tool that we had at one point. No,
Yes.
now we don't do this anymore, but you can see it affect them their mentally because it
Hmm.
causes depression.
Yeah.
It affect their sleep, can't
Hmm.
sleep, their bowels because they got constipated,
Yep.
and it affects their hormones as well. Most patients that on um, opioids have hypogonadism, so they will need testosterone. So
Right.
you're fixing a problem while ruining something else,
Yes.
right? While the PRP injection or regenerative medicine, it has no side effects. If it didn't work, like I tell my patient, it's not going to hurt.
Yeah.
It's not going to hurt, right? So it's to the point that we lowered our prices significantly for the patient. Just please try it, and we do days in our clinics that we do sometimes patients for free if they cannot afford it, because we
Hmm.
really would like to have the patient get an access to this kind of treatment. We do believe in it, and we're hoping to increase the education.
Hmm.
We've been on social media for quite some time just to educate patients on this kind of treatment and these modalities. I know it's easier and it's more covered to go for surgery, but if you have something easier, less invasive, why can't we try it?
Right. Oh, 100%. Now I know that you have a lot of things going on in the future. Can you tell us about what you see for your company in the future and where you're going?
So for the chronic pain sector, we are starting to use AI. We truly believe that AI is the future. So we're doing data mining. We have hundreds of thousands of patients that we treated for the past 20 years, and we're hoping to get some patterns and recognize what worked and what didn't work. So we'll be able to have better diagnosis, accurate diagnosis, and accurate treatments as well.
Right.
That's what we hope, to minimize any human error. So you go in or you come in for a treatment, we know that we treated a million case similar to yours, and this is the diagnosis and this is the treatment that worked for a lot of people. So AI will be leading the future of our company. We are expanding on the modalities that we and the treatments that we offer. We're going to expand geographically as well. Right now we're in Canada and Florida. We're hoping to expand to other states, New York and Michigan this year, to be able to bring our treatments to others and other states. And hopefully next year we'll expand beyond North America. On the surgical side, I'm very excited. Um, we moved from minimally invasive to micro-invasive. And let me give you a little bit idea about that. So traditional spine surgery, Stacey, is 3 to 4 hours. We usually cut the patient 5 to 6 inches incision. We
Mm.
cut muscles, we carve bones to get to the spinal cord. And
Yes.
then we do the surgery, and you're stuck at home for 3 to 4 months,
Mm.
right? While minimally invasive is 15 minutes.
Wow.
We use a scope like they use in the shoulders or the knees, and it's
Hmm.
5 millimeter incision, right? It
Yeah.
takes 15 minutes. After 3 days, you're up doing whatever you want,
Right.
right? So I usually call it the weekend procedure. Patient will have it on Friday. On Monday, will be back to the office or doing whatever they need to do, right?
Right.
So this is the micro-invasive. We're starting to use robotics as well, and we're experimenting with it. We're hoping to add it to our surgeries, and it's quite fascinating.
Yeah.
It's the robot will go in, will know exactly where to go, and the incision will be very minimal, blood loss will be very minimal, and the accuracy will be quite amazing. Not that we don't have accuracy with surgeons, but robotics are just amazing and complement what our surgeons are doing now. we're adding regenerative medicine to that as well. So we actually inject the areas with PRP. So
Mhm.
right now we do have RFA, radio frequency ablation, and after we burn the nerves, we do a PRP, and it regenerates the nerves as well. So we're going to expand on the usage of platelet-rich plasma, and I'm hoping to add peptides and exosomes, which is uh, quite amazingly tested for the past several years. You probably heard about the Wolverine stack and whatnot.
Mhm.
And we understand that a lot of clinics are using it now, but we are adding a genetic testing. So I know that people, it's readily available. People can order it online, but is it good for you or not?
Yes.
As you can see, my background is quite academic, right? I wouldn't advise you to take Wolverine stack or peptides without actually testing it, right?
Right.
So we're developing genetic testing to know if this is good for you or not. What's the dose? How
Mhm.
much and how long you're going to take it for?
Right.
We know you can order it online or whatever, right? There's a lot of clinics and pharmacy that prescribe that generously, but we're
Mhm.
really hoping to get it to the point that, okay, it is good, but with this dose, and it will benefit you for this
Right.
kind of condition. So that's what we've been working on.
I like that. And especially nowadays, there's so many different brands out there and not all of them are quality brands. And like you said, everybody's body's different.
Yeah,
Everybody doesn't need peptides and you have to have the proper dose, and people don't realize, but the dosage matters. Some people, if you take too much, you could really do damage to your body. If you take too
absolutely.
little, you get, you don't get the right effects, so you really need to be tested and supervised, so you have the right amount going into your body and you're also getting a brand that actually has good quality that's not going to be harmful to your body.
We all know from research, Stacey, that everything in moderation is good, right?
Hmm. Yes.
So peptides are great. They help regrow tissues, but I don't want to look back 5 or 10 years from now and say, oh, it's regrow tissues, but it actually converted to cancer tissues,
Right.
right? Because we know that cancer is just basically the same tissues, but growing faster than it should be,
Yes.
right? So if I have cancer, is it good for me? Like,
Hmm.
is taking peptides by mouth good for me, or
Right.
it's helping the cancer to grow?
Right.
You know what I mean? So I hate to prescribe peptides now or advise my patient to have peptides without the knowledge that you do not have cancer, or
Right.
it's gonna help your knees or joints, but it's gonna increase your cancer stomach.
Exactly. And isn't it
Right?
true that it's like a lot of us do have cancerous cells, they're just not activated. And
Yeah,
with, if you're using something, and that you shouldn't be using, you may
yeah,
have a chance of activating those cells that are not activated that are cancerous.
yeah. I know of patients, one patient specifically who had cancer spine, and they kept injecting PRP in his spine without looking at the cause. Um, and in my opinion, it helped his cancer to grow,
Mm,
right?
yes.
It's just, it just without knowing what you're injecting or where are you injecting it, you might actually be helping those cancer cells to grow. You're feeding them,
Right. Yes.
right? So everything, science is great, right? And it's quite amazing, right? But it has to be used properly,
Yes.
right? I hate patient just taking something and 5, 10 years from now, like I said, we cause something there. I wouldn't be able to live with myself.
Right.
Morally, it just is not the way that I practice.
Yes. No, I agree 100%. Just people have to be more educated and they have to be cautious. And just because you see, a commercial or info commercial or you see something or a celebrity is, maybe saying great things about it, don't just jump and do it, do your research, speak to a medical physician, get their advice, and I always say too, be your own doctor, but also convert with a doctor, find out research, ask questions, make a list of questions from your research, and then ask someone who is educated in that area, go over those questions and find out the answers so you are more aware. And then express your needs and then come up with a solution that will be feasible for your body and will be to have the best results.
Exactly, because each and every one of us have different stages in life. We are in different stages, each one of us, and have different activities, have different lives. Um, I personally had to give up a lot of my sports and activities, and I'm okay with that
Mm-hmm.
because I had shoulder pain.
Yeah.
Somebody else said, no, I cannot live without playing or going to the gym or whatever,
Mm-hmm.
right? And I need the surgery now. Okay, let's try and get this fixed then,
Right.
right?
Mm-hmm.
60 years old are different than 20 years old, right?
Exactly.
They're just happy to manage their pain, pain-free, watch the grandkids or whatnot, or
Yeah.
play a golf um, uh, for twice a week. But 20
Mm-hmm.
years old has got their whole life in front of them, and they need to get back active through work, university, or sports. So it's totally different. What's gonna fit for me is not gonna fit for you. Could
Mm-hmm.
be, like I said, the best surgery, could be the best surgeon, but it doesn't fit my needs.
100%. Now, can you tell us a little about the services that you provide?
So we do provide chronic pain management through traditional pain management, injections and procedures. But we do also we start doing spinal stimulator, peripheral stimulator for patient that and so much pain. We do SI joint fusions. We're getting really heavy on regenerative medicine, so we use PRP, stem cells, peptides, exosomes heavily, and we're experimenting with umbilical cord and other stuff that help the body regenerate and regrow. Very heavy on that now. Anti-aging, so we have programs that we take the patient, we test them genetically, and we see what's missing that will regenerate and rejuvenate their cellular level.
Mm-hmm.
We know now for sure that there is a breakdown at age of 40, another breakdown in the cells at age of 60. So we have our own protocols for that. We also do a spine surgery. We do minimally invasive, we do micro-invasive for spinal stenosis, so any narrowing in the spinal cord,
Mm-hmm.
canal, any disc bulging, any disc herniation. We do fusions as well for slippage of the spinal cord. We do SI joint fusions, like I said. We're adding orthopedics, hopefully by the end of the year, for endoscopic shoulders, knees surgery. Yeah, that's basically what we're doing right now. And we're hoping to add services, as I said, and expand our service and our footprint this year.
Oh, wonderful. That's exciting. Now, where can people find you if they want to get in touch with you?
We people can find me on I have a website, drdamian.com, on my Instagram, Dr. Hany Demian, my Facebook, Hany Demian, LinkedIn, Hany Demian, and you will find me. I'm the CEO of Biospine Institute in Florida, pain care clinics in Canada, Percentia Healthcare LLC. I'd like to communicate with patients and with anybody that have a question or wondering what we do or what could be done. And if we cannot help them, I'll be very happy to direct them
Mm-hmm.
where to go. As I said, I'm a physician, first and foremost, and the CEO. Second, I still practice and I enjoy my practice more than managing the company. Both are
Mm-hmm.
very thrilling, but I love practicing because it connects me to the patients
Yeah.
and to their needs, and that helped me actually complete my vision for the business
Right.
on their side. So I'd like to keep my hands on the pulse all the time.
Oh, I love that. Now, if we had to take today's conversation and you wanted to emphasize on it in some important factors that you feel the listeners would benefit from, what are some things you'd like to emphasize on?
Don't take your back for granted
Hmm.
ever.
Yes.
Be like I used to say, there is defensive driving and there is defensive back health. So make
Yes.
sure that you don't lift heavy, exercise as much as you can because muscle is strongly correlated with longevity and then anti-aging. Exercise as much as you can. Drink water. And on the business side, I always love to say just begin with the end clearly in front of you and in mind. Where do you want to be and how are you going to get there? And
Hmm.
that will actually direct your daily, weekly, and monthly activities to where you need to be. This advice helped me with my patients
Yes.
and helped me with my business.
Hmm.
When I meet the patient for the first time, we sit down and we usually discuss the plan. We just don't go without plan ever. And the
Yeah.
patient leaves the room, understand what's the plan for the next few months until his journey of recovery.
Right.
Yeah. So yeah, those are the main points I really would like to stress on.
I love it. I love it. Well, this has been amazing, Dr. Damian. I loved having you on the show. I hope you'll come back. We could talk more about this in depth, but this has been a pleasure. And thank you for all your knowledgeable information. I think it's really important that people understand that there's not just, surgical procedures or medication to resort to, but there are a lot of natural procedures out there that could benefit your body and your healing process and make you feel the way you used to and get rid of that chronic pain because chronic pain can be very depressing and hold you back from the way you want to live. But if you do it the right way, and there are a lot of natural ways to do it, you could actually rejuvenate your mental health, your physical health, and your overall life where you could be productive and happy.
Thanks a lot for having me. I would love to come back and discuss further advancement in chronic pain and spine surgery. Thanks for having me.
Oh, you're very welcome. Thank you, and you have a great day.
Thanks a lot. Thank you.